All right, everybody. Welcome to Monday Nights Live with me, Dr. Jarod Ward, a holistic chiropractor and functional health medicine provider in Southwest Florida, and to my patients all over the United States and Europe. So I have questions today that I get to answer that have been given to me in my question box yesterday. So there's always a question box on Sunday if I'm doing a live on Monday. So drop your questions in the box for me. If, however, you miss the box, no problem. Pop onto my Instagram live or my YouTube live and type out your questions. Okay, so let's get started. Did you guys like that I was taking my cat on a walk? I thought that was kind of funny. That was actually an old video, but hey, if it hits once, use it again, right? So a lot of people ask questions about my cat, so I appreciate your interest in my personal life and Theo's life, so I'll answer those because why not? It's fun. But this is for health questions. This is for education purposes only. It is not instead of you working with your doctor. If you want to work with me, great, but this is not that time, okay? So let's start with our first question. This question is great because it kind of coincides with what I'm doing right now with a group of people. Okay, so I offer group cleanses now because they're awesome and pretty much all my patients need one. I was also talking to an acupuncturist mentor of mine. It's not who you're thinking of. And they worst and weakest organ in the entire nation. Almost everybody has this organ that's struggling. Guess what it is? It's the liver, okay? Because basically you are a fish tank and you've been having this filter your blood for years, decades, half a century, I don't know, and you've never cleaned your filter, okay? Of course, the liver does a pretty good job of cleaning itself, but give it a little turbo. So that's why I started offering group liver cleanses because one, my wait list for my in-person patients started getting so long. And I'm like, how can I help these people that are waiting to see me? How can I get them the most bang for their buck, right? And my decision was liver cleanses. So that's awesome. But anyways, another group cleanse that I offer is a parasite cleanse. I have lots of people. I would say about 40% of the people doing the cleanse are visually passing worms about this long. Okay. Those are the people who are looking. Some people are not looking, so they might be passing something we don't know. Okay. But usually when you're about to pass one, you feel pretty fatigued. You might even have a twinge of pain in your colon, and then because its teeth are in your flesh, right? And then it lets go, pops off, it dies, and you pass it. So that's pretty fascinating. But yes, that's my parasite cleanse. So first question, that's my long spiel into the first question that we're going to open up with today. Can severe sleep issues and not hitting REM sleep be caused by parasites, or is that just a nervous system issue? Well, I would say, why not both? Okay, because when you have parasites and they're inside and they become more active at night because they're nocturnal, right? They actually become more active during a full moon as well because they respond to our own increased production of serotonin. But that's a little bit off topic. Anyways, when they're more active at night, they're secreting more toxins, they're creating more irritation. There's more, hey, how's it going? Feel free to say hi in the comments, guys, or ask your question. What are you thinking about? I want to know. Anyways, but when parasites are more active at night, that not only is going to disturb your sleep, but it's also going to disturb your nervous system. So yes, when sleep is disturbed, your nervous system is disturbed. You don't have to have parasites to have sleep issues, obviously, right? But a nervous system that doesn't have enough nutrition, like whole food B vitamins, right? The B vitamin that I really love to give my patients to help calm and build that depth of stress resistance is called Cataplex B Core from Standard Process. I think everyone should be on it. I tell my patients you can either cook and eat liver 3 times a week, or you can take Cataplex B Core because liver is the most nutrient dense food, right? Cataplex B Core you can buy at the link in my bio called Dr. Jarod's Standard Process Store. It's pretty easy. It's awesome. Okay, so that's one of my core 4 supplements that I think everyone should take. So if you want to really bring nutrition and ease and depth and relaxation and calm to your nervous system, which I think everybody could use, that's a solution. However, if it is caused by infection, a lot of sleep issues at night caused by parasites or viruses or bacteria, we need to clear those out before we'll see sleep resolve. Parasites at night is going to feel like the following. It's going to feel like anxiety. It's going to feel like teeth grinding. It's going to feel like clenching your jaw. It's going to feel like vibration sensations in your body. It's going to feel you might have the itchy rectal area because there's a certain type of species of parasites that comes out at night, pokes out, and lays their eggs on your skin around your rectal region. Those are called pinworms. They're most commonly in children, but they don't discriminate. So those are the sensations you'll have if it is parasites indeed disrupting your sleep. Clenching jaw, grinding teeth, anxiety, rectal itching, and vibration sensation in the body. And then, of course, if you're waking up and your first bowel movement is pretty loose, that's a sign of an infection overnight, festering bacteria or parasites growing, releasing toxins. And then in the morning, your body wants to get rid of everything that was building up overnight. So if you have a pattern of, in the morning, my stool is a bit loose, the rest of the day it's fine, you might want to think about infection in the colon, usually bacteria, usually parasitic. It could be fungal, really anything. However, if it's viral that's disturbing your sleep, what you want to think about or examine or think about is that usually obviously if you have a virus and you're fighting it, you feel it. Okay, we're not talking about that. I'm talking about a virus that's lurking beneath the surface of your immune system, and it's degrading and pulling your energy. It's hijacking your mitochondria. It's robbing you of your future, of your cellular energy. When that's going on, you're going to have night sweats. Night sweats, most of the time, I find are related to a sneaky, low-grade viral infection. Okay, so that's parasitic infection, viral infection. Okay, those are the clear ones. Bacteria and fungal, I do not find as clear symptoms, especially in terms of sleep disturbances. So to answer your question, can severe sleep issues and not hitting REM be caused by parasites, or is that just nervous system issues? It could be both. Another way to really enhance the brain to help you achieve that REM state and those deep sleeps. Do any of you guys wear like a sleep tracker? Like I have a Whoop. I really like it. I know like wearing a biometric tracking device is probably a little bit debatable now these days, but I like the information I get from it. I've been working on my HRV, which is a measurement of basically the depth and resilience of your nervous system. I've been working on it for many years. So my good HRV is usually about 125. Most people's HRV, I would say, is in the 30 to 60 range. So it's a measurement of the depth and health of your nervous system. Anyways, and when your nervous system is healthy, you will go through those waves of sleep and sleep cycle more effectively. Another way to do this is, of course, to enhance REM sleep and make sure you're getting there is to have plenty of minerals. So you could add pink salt to your water. You could add Celtic sea salt to your water. You want to hydrate, and then you also want to mineralize. Those things nourish the nervous system. They make sure you have plenty of blood flow so that you have what you need going to the brain while you're sleeping. Okay, so those are some things to just enhance REM sleep. I know that was a really long-winded answer to that question, but I wanted to show how it could be both and, either or, and something else. Okay. All right. Next question. If experiencing a year's worth of continual viral infections from a low immune system, how do you go about strengthening it? I've done homeopathics and supplements. Nothing so far seems to have worked. All right. Well, I would ask, okay, there's a couple things here. Where are you getting your supplements, first of all? Are they any good? What I would want to see is I would want to run a very simple lab test called a CBC with differential. The CBC with differential will tell me how many white blood cells you have in your body, and then there's 5 types of white blood cells: neutrophils, lymphocytes, eosinophils, monocytes, and basophils. Basically, I want to know, out of this army of 5 divisions, right, what is the body prioritizing in making more of? If the body's making a ton of neutrophils, you probably have a low grade, you have a bacterial infection, the body can't seem to kick. If you have a lot of lymphocytes, the body's making a lot of lymphocytes to deal with a viral infection that it can't seem to kick. So what is draining the resources in the body? And then white blood cell count tells me how many troops do I have total. So if you have a high white blood cell count, the body's making a lot of white blood cells because there's a current problem that it's very well aware of. If the white blood cell count starts to become low, it means the body has been fighting for a very long time and it's starting to become exhausted and it can no longer make the amount of white blood cells that it wants to because you're just burning through its energy, right? So that's what I would order first. I want to see, how's the army doing? Do we have enough troops? And then is the body making the proper ratio of different types of troops to help your immune system? So I would do that. Once I know those questions, there are a lot of different herbs and supplements that I would recommend from very specific companies that work very well, because you cannot trust supplements on Amazon, Costco, Whole Foods, Walmart, etc. You need to research your brands, and that's why I only use practitioner grade brands that I know and trust. So what I would try, if you're continuing to get a virus, just in general, some herbs that I would try. The first one is eleuthero. It is an herb for an exhausted immune system. So it's going to help you with your energy, and it's going to also help revitalize the immune system. Another one is echinacea. I always love echinacea. I use echinacea premium from MediHerb. You can get all these at the links in my bio. The echinacea premium helps modulate the immune system. So it helps revitalize an exhausted and depleted immune system, and it helps regulate an overactive autoimmune immune system. There's a lot of lies on the internet about echinacea that you shouldn't use it in autoimmune cases, but that's actually not true. Echinacea also works best as prophylactic immune support, so it helps you be strong so you don't get anything, but you can also use it in high doses to clear out a current infection. Hi, everybody. Thanks for saying hello. Miss Michelle, and then who else is here? Great. Another one that's viewed, that another product that is classically used for a low white blood cell. Hi, Mom. Another herb that's used for a classically low white blood cell count is astragalus. Astragalus is amazing. Again, I use astragalus complex from MediHerb. I have never seen that not work at bringing back that low blood cell count. Hi, Nicole. So that's something you could try. However, those are herbs, right? So whenever we're using herbs, think about that as like a turbo or like a PhD class for your body. It's helping to educate the body on what to do. It's helping to drive a reaction. However, your body also needs the raw material or the food to make this happen, right? So the food, for a lot of times for white blood cells, has to do with like bone, or I would recommend something called Immuplex or something called wheat germ oil, right? Wheat germ oil sounds like, oh, wheat's inflammatory. Well, wheat germ oil is actually the part of the wheat that they get out of the refined flour. So it's actually the more nutritious part of the wheat, but it helps your body make healthy cells. It also works really well in fertility. So if you're not trying to have a baby, be careful with wheat germ oil because it will make you a bit more ready to do so. So I use that in my fertility cases. I've talked a lot, but those are some things I would talk about. I would try with a low immune system. Obviously, I'm a chiropractor. Every time you get your neck adjusted, it boosts your immune function. Why is that? Your thymus gland is right here in your chest. The thymus gland is what I call white blood cell university. It's where all the white blood cells float. They go here. They learn what to do. If they don't pass, they're out. If they can't target the bad guys and leave the good guys alone, they don't make it back into the immune system. This thymus gland is controlled by nerves in the neck. If the nerves to the thymus gland are not 100% beaming their light and electrical energy into the thymus gland, you're not going to have a fully functional thymus gland. Your immune system is going to not be as smart as it could be. I have so many patients. As soon as they started seeing me regularly, they're like, I used to get sick 3 to 4 times a year. Ever since I started seeing you, I don't get sick anymore. 1, because I'm making sure that they're on certain supplements, but also 2, getting adjusted enhances your brain to immune system neurological connection. So I would try that. Get adjusted, take some immune building herbs, get some sunshine, try that. Okay. Beautiful. I hope that helps. Another question. This is a loaded question. Biopsy. Let's talk about biopsy. Has anyone heard about maybe the negative, I shouldn't say negative side effects, but the suspected bad side of a biopsy, specifically in cancer cases? Let me know. Anyone heard about it? I got some people watching. Say yes or no. But basically, the biopsy, the theory is that the body walls off a tumor with a membrane, right? Or an infection with a membrane. Let's say tumor in this case, okay? The big C word, right? So the body will wall off this C word mass with, there's a yes, with this membrane. And when this membrane is there, its job is to keep the cancerous cells from spreading throughout the body. That's the hypothesis, right? Well, when you do a biopsy, what do? You punch through the membrane, right? When you punch through the membrane, then you are now breaking this natural mechanism. And now the theory or this thought process talks about how the biopsy actually enables the metastasis of the cancer. Okay, so that's the idea. I think it's plausible. Am I like gonna die on this hill? No. I do think the body is smart and walls off infection, but I'm not necessarily going to talk my patient out of getting a biopsy if they want to get a biopsy. If they don't want to get a biopsy, I'm not going to talk them into it either, because honestly, I'm not an oncologist. I support people's health and I support their bodies. I don't treat cancer. But that is a great question, and I like that you brought it up. But the body's intelligent, right? There's usually a sheath or a fibrous membrane for a reason, right? Your skin is there for a reason. It's a fibrous membrane. The brain has a bag surrounding it called the dura mater. And the dura mater becomes a casing all the way around the spinal cord. It goes all the way down to the pelvis, right? And in between the dura mater and the brain is a space, and in that space is called cerebral spinal fluid, and that cerebral spinal fluid washes the brain. And so that fibrous membrane is important, right? So whenever there's a membrane, the diaphragm, you could say, is a membrane, and when you helps the lungs work, right? So I mean, the body is amazing. And so if there's a membrane around mass, perhaps it should be left alone. So anyways, good thoughts. Okay. Someone asked about osteopenia and osteoporosis help besides pharmaceutical injections that were suggested by the medical doctor. I love this question. Okay. The cats are running when I do that. Couple of things. Okay, so the problem with osteopenia, osteoporosis, there's a couple of theories of thought and a couple of presentations that could happen in any patient, right? Whenever there's a condition, there's never just one cause of the condition. There never is. So there's one thing that I would look into with a patient with osteopenia and osteoporosis. Why is the bone demineralizing? We have to ask that question because that's what's happening, right? The bone is demineralizing. Why? It's most commonly in women, right? So why is that happening? I would propose that there are 3 reasons why the bone would be demineralizing in osteopenia, osteoporosis. Okay, 1, you're just not getting enough nutrition. Okay, most people say, oh, I need more calcium. No, I would say you need more magnesium and manganese and bone itself, like collagen, right? So like there's a product called Calcifood from Standard Process. They're like chewy wafers, but it's actually literal bone, right? Eat bone to repair bone. That's a Chinese medicine concept. You eat that what you want to heal. So this bony matrix, right? If you're eating bone, your body's like, oh, I know where to put this, right? So I would try that. And then manganese, boron, magnesium, all those minerals are really important. And then also people are just taking a really bad form of calcium. So I prefer calcifood for bone building. There's also a product called Ostrophin PMG. It's called a protomorphogen. It's made by Standard Process as well. And this basically, imagine it's a blueprint. And you eat this blueprint, or you take it on an empty stomach, and it tells the brain, here's bone. We have a problem. Here's how you make bone. And so the brain's like, oh, bone. I should repair that. Cool. So I would if someone came in with osteoporosis, osteopenia, if it's just a nutritional problem, I would put them on calcifood. I would put them on magnesium, Easy Mag. I would do a form of manganese, boron, and then I would also do Ostrophin PMG. Okay, so that would help a lot, I think, more than the injections. Because what are the injections? They're a drug, right? Are they providing bone material to bone? No. Do you need that? Could you do that for a time while you also consume the material you need for your bone? Sure. So first cause, just lack of bony nutrients. Okay. Second cause, lead exposure. Lead toxicity. Okay, lead gravitates towards bony material. So aluminum and heavy metals like aluminum, mercury, they really like going to the brain. Lead, for whatever reason, because of the balance of like the charge of calcium versus the charge of lead goes to bone. So sometimes when your bone loses the mineralization, it's because there's been too much lead exposure over this person's life, and there's so much lead in the bone, there's no more room for the calcium. So then you have to work on detoxing lead from the body, and you have to work while you also feed the nutrition to the bone that the bone needs. Okay, so toxicity is the second, specifically lead accumulation. I shouldn't say lead toxicity because they're not going to die from it usually, right? But lead accumulation, too much lead over the course of their life. That's my second reason. And then thirdly, I should probably write my thoughts down because I had 3 reasons and I don't remember. Oh, hormones. Okay. So when a woman goes into menopause, her estrogen goes, okay. And when estrogen goes down, estrogen is the proliferative hormone, basically proliferative meaning building tissue, right? And so if there's not enough estrogen in the body, the bones will no longer have the signal to build, right? So if you have a bit of lead exposure over the course of your life, you're not really eating enough of the bony mineral nutrients that you need to sustain bone, and the signal to build bone goes down over time, you have the perfect storm. So whenever a woman goes into menopause, the ovaries are like, we've been working for a really long time, we're ready to retire. Bye guys, we're going to retire. So the ovaries retire. Someone has to do the job of producing some hormone, right? What gland does the job of the ovaries when the ovaries take a back seat? Does anybody know? Take a guess. I'll tell you. The gland that takes over for the ovaries is the adrenal glands. What do most women and people do over the course of their life? They have a lot of stress. They're burnt out. Their adrenal glands are fatigued. They have high HPA axis dysfunction and dysregulation. Good job, Mom. She said adrenals. So when the hypothalamus, pituitary, and adrenals are just like, and they're dysregulated, right? When the ovaries take a back seat, the adrenals won't come forward. And when the adrenals don't come forward, then they don't help produce the amount of hormone that the aging female body needs, and then the bones begin to deteriorate. So bone health and adrenal health are closely related, and so I would propose that the average stressed out woman, well, I should say the highly stressed out woman, is more apt to develop osteoporosis than someone who is prioritizing adrenal health. Also, here's another connection between that. If the adrenals are really stressed and the adrenals are burning, they consume the most vitamin C in the body more than anything else. When the adrenals eat the most vitamin C, another function of vitamin C is to help make and tie together collagen. The bones are made of collagen, and then they throw calcium and minerals on the collagen formation. So if the adrenals are burning up all the vitamin C, you have no vitamin C to help your bone make collagen. So over time, That's what's happening, right? So that's why adrenal health is very connected to bone health, osteoporosis, osteopenia. Not only because the adrenals help the body have healthy hormones after menopause, but because the adrenals and the bone structure both rely on vitamin C. So if you aren't supplementing or having enough vitamin C in the body to support both, one of them will suffer. The most urgent person wins. The urgency of the adrenals being revved up from your very stressed out lifestyle will consume the nutrients. So it's crazy, isn't it? Everything's interconnected. Blows my mind. So I would take vitamin C, magnesium. You get it. I've talked about it enough. But that is my thoughts about osteopenia, osteoporosis. An injection is not going to treat all those angles, is I guess the way I'll say it. So excellent. All right. Next question. I'm not really sure what some of these abbreviations are. Sorry. Let's see. Someone asked about POTS. POTS is becoming increasingly common. POTS, polyorthostatic tachycardia syndrome, I think is a really fancy name for what's called dysautonomia. Dysautonomia is dysregulation of the autonomic nervous system. Okay. Autonomic nervous system, you have parasympathetic and sympathetic. Rest, digest, heal, fight or flight, right? You can only be in one mode at the same time. So POTS is dysautonomia. It's where the body basically, when you stand up, your heart might go crazy. You might not feel well, right? Because your brain is so dysregulated between these two modes, it can't recognize, oh, I should control my heart a little better when I move around, okay? I'm oversimplifying it, but that's what I think is happening. What can cause problems in the autonomic nervous system in this way? Infection, lack of nutrition, lack of being adjusted, right? Because every time you adjust the body, it helps the brain. Ooh, I know how to switch back and forth between these two modes. Perfect. This is like dancing, easy, right? So that's why chiropractic is so important. It helps your brain oscillate and navigate life, right? Adaptability. It helps you adapt to your environment. In the wild, right? The animal that lives the longest and is the healthiest is the one that can adapt the most. We're the same. Chiropractic adjustments and regular chiropractic care helps you be adaptable more than someone who's not getting it, right? Helps the immune system adapt. It helps the heart rate adapt, right? So POTS is really an inability to adapt. And how do you fix that? Well, you clear out infection. You nourish the nervous system in the body with good nutrients, right? And then you get adjusted. So that's how I would heal someone of POTS. I mean, that's bird's eye view of the philosophy behind how I would heal someone with POTS. That's not everything I would do. Okay, next question. There was a question in the chat over here, actually. Let me pull that up. All right. Someone asked, Doctor, my gallbladder was supposed to be removed several years ago due to a vicious and painful attack. I don't want to remove it. What can I do currently to alleviate any future attacks holistically? All right, here's some things to try, okay? Also, like, to be clear, I think you guys know this about me. I'm not ever against a needed surgery. I'm against surgery first, right? So some ideas, okay? Whenever there's a gallbladder attack, we want to think about the bile. What does the gallbladder hold? It holds the bile. It's a room to hold bile. That's it. Bile's made in the liver, it goes to the gallbladder, it sits there. It's a little room. Little rooms can become infected. The bile can become really thick, like pudding, right? We don't want pudding bile, we want watery bile. So some things you can try to help support healthy bile is, let me scroll down, sorry. Some things you can do. Oh, what did I just do? I put a date on this video. I don't know how to turn that off. Anyways, so some things you can do to help support healthy bile is beets and beet greens. So a product from Standard Process I really like. I don't like this at all. product from Standard Process I really like is called Beta Food. Beta Food has a lot of beet greens in it. When you do beet greens, that helps thin the bile not only in the liver, but also the gallbladder. It helps drain it out. Okay, so that's ideal. Another thing that you might want to consider, there is a product from Mediherb called Livtum Complex. And let me look up the ingredients again. Globe, artichoke, dandelion, and milk, but with an emphasis on making sure the bile is healthy. So I would try that. Also, what you can do, you can do bile salts. But also, whenever you're thinking about a room that can become infected, right, there are parasites and liver flukes that can live in the liver and in the gallbladder system. And when there's a parasitic infection in the liver, or there's liver flukes in the system, it causes swelling around the liver, but also within the liver. And the liver is full of a bunch of little roads, right? And those roads are where the bile and the blood flow through the liver. And yet if the walls get swollen and they start pushing up against the roads, it doesn't work as well. So you have to clear out infections sometimes as well. So different antiparasitics are really great. I have a parasite cleanse I offer once a year. I already talked about it, and it will help that as well. Bacteria, fungus, everything. So you have to think about infection. But that's where I would start. I would start with beets, beet greens, Beta Food, Livton Complex, of course, lots of water, things like that. I'm not really a person. You could do like a coffee enema if you're feeling really I don't know, open. You could do a coffee enema. That could help as well because it helps flush the liver. I'm not someone who really recommends people doing like liver flushes or gallbladder flushes. I'm not against them. I don't know a lot about them, but you could try that as well. All right. Someone asked me, there was another question. Let me find it. Someone asked me if I walk my other cat too. No, I don't. I just tried to walk the big one because I saw some cool videos of like Maine Coons going on the boat with their owners, but every time I literally hold him and take him outside, he starts crying. He's the biggest baby ever, so it's not going to happen. But yes, I have a Maine Coon. I used to take him on walks. That was an old video, but it got your attention. So he is a Maine Coon. That was the other question that I was being asked. I think that's... Oh, wait, there was one more question. Have I worked with families who have little ones with feeding aversions and feeding troubles? Yes. Infants, toddlers, pediatrics who don't want to eat, low hunger. Yes, I have fixed that several times. Yeah, I think that answers your question. It's always different. In the pediatrics, like, not toddlers, a bit older, it's usually a pituitary problem. Their pituitary is under stress for some reason. And the pituitary being under stress means it won't make growth hormone. Growth hormone is what makes you hungry indirectly, right? And it's because you need to eat to grow. And so a lot of times you clear out whatever is stressing the pituitary, and then you nourish the pituitary and you repair it with certain things. I use Pituitrophin PMG from Standard Process. It's literally a product to help heal the pituitary gland. It's amazing. It's so cool. There's no product, I don't know of a pharmaceutical that is developed to heal the pituitary gland. They'll inject growth hormone into you, but they won't heal the gland. So it's fascinating to me. Yeah, so that's that. Have I had any success with treating tinnitus? Yes, I would say about tinnitus is tricky. And therefore, I would say I fix it about 60 to 70% of the time. Sometimes it heals like that because tinnitus has to do with the inner ear, right? For whatever reason, the nerve in there is like, zzz, right? What causes the nerve to do that? Again, infection, toxicity, misfiring, right? Too much fluid accumulating in the inner ear. Tinnitus and like vertigo, those are very related. Vertigo is usually a bit easier to fix for whatever reason. Tinnitus, sometimes I get it to go away with like one supplement, one adjustment. Other times I can never move it. So it's tricky and it depends. Good question. Someone else asked me, what supplements would I recommend for a 10-year-old girl? Well, if she doesn't have any like particular issues going on, I would recommend Cataplex B Core, Easy Mag, and Ulprima EPA DHA. Okay, here's why. Cataplex B Core has tons of healthy foods in it, right? Food heals the body, drugs don't, right? And even like nutraceuticals or like vitamin C made in a lab doesn't heal the body, right? Cataplex B Core, it nourishes the brain, the heart, the nervous system. It provides energy, provides calming energy to the body. I would do that. Easy Mag, because it is the best type of magnesium on the market. I just went to the farm where they make it. It's amazing. They stack it against magnesium threonate and magnesium glycinate all the time, and they study, okay, which product gets into the brain better to nourish the brain, and then which product lasts in the brain longer. Every time it's Easy Mag. Easy Mag is made from basically the juices of greens. So taking a dose of Easy Mag on the bottle is the equivalent of eating a pound of greens. So that magnesium, there's over 40 different types of magnesium in that product. Broad spectrum. Everything in nature is broad spectrum nutrition, right? It's not just like one type of magnesium. Magnesium glycinate and magnesium threonate are made in the lab. They're technically synthetic, right? So Easy Mag crosses into the brain better than anything else, goes over the blood-brain barrier, and stays in the brain longer than any other magnesium on the market. So that's why I would add that. So Cataplex B Core, Easy Mag, and then finally Ulprima EPA DHA, which is a really high quality omega-3, not fishy, and that's beautiful for anti-inflammation, healthy fats for developing hormones, etc., etc. If there's any specific concern in general for like supporting hormonal development, I would recommend Ovex or Simplex F from Standard Process. So I hope that helps. You're very welcome. So, all right. Any other questions, my friends? Thanks for asking questions on the live. That was fun. That had like 3 or 4 tonight, and that makes it a bit more interactive and enjoyable for me. So I think that's all. I appreciate it, you guys. Have a great night, and I will see you next week. Come with your questions. Your free hour with a holistic doctor. So, bye.